This particular syndrome was described by Harvey Cushing. Okay, that's why the name Cushing syndrome is given to this clinical condition. In this condition, there is excessive secretion of glucocorticoids. That's why it is termed as hypercortisolism also. Okay, cortisol levels are increased in this case. Now, if we talk about the causes, it can be caused by several ACTH means adrenocorticotrophic hormone independent reasons and some causes that are dependent upon the secretion of ACTH. Okay, so you can see all the causes here. Okay. Now there is a difference between Cushing disease and Cushing syndrome. So what is Cushing disease? The syndrome or the clinical condition we can say that occurs because of tumors of anterior pituitary. And Cushing syndrome particular term it is used whenever there is hypersecretion of glucocorticoids. So you must be able to understand the difference between these two terms. Don't get confused. What is Cushing disease? What is Cushing syndrome? Okay. Now about the clinical features that are seen in a patient who is suffering from Cushing syndrome. First and foremost is occurrence of centripetal obesity. What is the meaning of this centripetal obesity? There is peculiar distribution of fat in which fat is more deposited in abdomen and over the upper back. Okay, you can see the distribution of fat. In the figure A, you can see peculiar distribution of fat over the body. Okay. Now, second is buffalo hump. Fat, it gets deposited in lower neck and over the interscapular region. Thirdly, there can be occurrence of reddish purple stria over the abdomen. So what is the reason for occurrence of this reddish purple stria over abdomen? It is a very frequently asked question in examination. What is the physiological basis of occurrence of these stria? So these stria, they occur due to stretching of the skin. And why does the skin get stretched? Because of more subcutaneous depots and rupture of the subdermal tissues. These 2 points are very important. You have to keep these points in mind. What is the physiological basis of occurrence of reddish purple stria in a patient who is suffering from Cushing syndrome? You can see the occurrence of reddish purple stria in figure E, F and G. You can see these lines. Okay, these are the reddish purple stria that are seen. Person is supposed to be having moon face. Moon face means moon-like shape of the face. Why does this shape occurs? Because of fat deposition. Salt and water retention, it can also contribute. You can see the moon faces here. Round type face. Person can also have very thin and poorly developed muscle. Okay, and this condition, it can lead to precipitation of insulin-resistant diabetes mellitus. Why? Because of excessive catabolism of proteins, the amino acids, these are converted into glucose by the process of gluconeogenesis. Okay, so this type of diabetes mellitus, it is resistant towards insulin because insulin is not there. Okay. Bones, because of excessive resorption and reduction in the bone formation, the patients are susceptible towards osteoporotic fractures. Legs may appear to be thin because of increase in protein loss of the skeletal muscle. Poor wound healing, weakness, irritability, hypertension, peptic ulcer, thin hair, frank psychosis, euphoria, insomnia, they can also tend to occur in a patient who is suffering from Cushing syndrome. Now, how do we treat this clinical condition? If the condition has occurred because of usage of certain kind of drugs, first and foremost thing has to be to stop these medications. Okay. And if the clinical condition is occurring out of some tumor, then surgical resection, it is the only option. Okay. So we had talked about Cushing syndrome in detail. If a question is asked about Cushing syndrome, you will have to tell about the causes, what are the clinical features and the physiological basis of each and every clinical feature. I had told you the physiological basis of centripetal obesity, why buffalo hump occurs, what is the reason for reddish purple stria, why moon face occurs, why there is occurrence of insulin resistant diabetes mellitus, why there is risk of osteoporotic fractures. You can see the images over here. And lastly, we had talked about the treatment of the clinical condition as well. Okay. Thank you very much. In the next class, I'll talk about hyperaldosteronism.